Hey guys, today we will study about local anesthesia. First we look on what is local anesthesia. Local anesthesia is a medical technique used to temporarily block sensation or pain in a specific area of the body while the patient remains conscious. It is typically achieved by administering anesthetic agents, such as lidocaine or novocaine, directly to a localized area, such as a specific body part or a small region of tissue. This allows medical procedures, surgeries, or interventions to be performed without the patient experiencing pain or discomfort in the targeted area, while the rest of the body remains unaffected. Local anesthesia is commonly used for minor surgical procedures, dental work, and various medical interventions where pain control is essential, but the patient does not need to be completely unconscious, as in general anesthesia. Significance of local anesthesia in medicine. Local anesthesia is of significant importance in the field of medicine for various medical procedures and surgeries. It plays a crucial role in pain management and patient comfort by temporarily numbing a specific area of the body while the patient remains awake and conscious. Here are some key aspects of the significance of local anesthesia in medicine. 1. Pain management. Local anesthesia is primarily used to block pain signals in a specific part of the body. By doing so, it allows medical professionals to perform procedures that would otherwise be extremely painful or intolerable for the patient. 2. Minimizes systemic effects. Unlike general anesthesia, which affects the entire body and places the patient in a state of unconsciousness, local anesthesia is localized to the site of the procedure. This minimizes the potential risks and side effects associated with general anesthesia, making it a safer option for certain patients. 3. Outpatient procedures. Local anesthesia is commonly used for outpatient or minimally invasive procedures. Patients can often go home shortly after the procedure without the need for an extended hospital stay, which can reduce healthcare costs and improve patient convenience. 4. Rapid onset. Local anesthetics typically take effect quickly, allowing medical professionals to proceed with the procedure promptly. This can be especially important in emergency situations where immediate intervention is required. 5. Reduced recovery time. Since patients are awake and alert during procedures performed under local anesthesia, their recovery time is often shorter compared to those who undergo general anesthesia. This enables patients to resume their daily activities more quickly. 6. Customization. Local anesthesia can be tailored to the specific needs of the patient and the procedure. The dosage and type of local anesthetic used can be adjusted to achieve the desired level of pain relief without causing excessive numbness. 7. Versatility. Local anesthesia can be used for a wide range of medical procedures, including dental work, minor skin surgeries, joint injections, and even childbirth, epidurals. Its versatility makes it a valuable tool in various medical specialties. 8. Safety profile. Local anesthetics, when administered correctly, have a favorable safety profile with minimal systemic side effects. They are less likely to cause complications such as nausea, vomiting, or postoperative confusion, which can occur with general anesthesia. 9. Elderly and high-risk patients. Local anesthesia is often preferred for elderly patients or those with underlying health conditions who may not tolerate general anesthesia well. It is a safer option for these individuals. 10. Reduced healthcare costs. By avoiding the use of general anesthesia and its associated equipment and personnel, the use of local anesthesia can contribute to cost savings in healthcare. Local anesthesia is a valuable tool in medicine that allows for effective pain management during a wide range of medical procedures. Its ability to provide targeted pain relief while minimizing systemic effects makes it an essential component of modern healthcare, improving patient comfort, safety, and recovery. Types of anesthesia. Anesthesia is a medical practice used to alleviate pain and discomfort during medical procedures or surgeries. There are several types of anesthesia, each with its specific applications and methods of administration. Here, we will introduce three primary types of anesthesia: general anesthesia, regional anesthesia, and local anesthesia. 1. General anesthesia. General anesthesia induces a state of unconsciousness, where the patient loses consciousness and is completely unaware of the surgical procedure. It is typically used for more complex or invasive surgeries. How it works: general anesthesia is administered intravenously or through inhalation. It affects the entire central nervous system, leading to unconsciousness, muscle relaxation, and loss of pain sensation. Use cases: general anesthesia is used in major surgeries, such as open-heart surgery, abdominal procedures, and complex orthopedic surgeries. It ensures the patient is completely unaware and pain-free during the operation. 2. Regional anesthesia. Definition: regional anesthesia involves blocking pain sensation in a larger part of the body, typically a limb or a section of the body, rather than the whole body. It allows the patient to remain conscious during the procedure while numbing the specific region being operated on. How it works: regional anesthesia can be administered through various techniques, such as epidurals or nerve blocks. It involves injecting anesthetic agents near nerves or the spinal cord to block pain signals in the targeted region. Use cases: regional anesthesia is commonly used for procedures like knee or hip replacements, childbirth, epidurals for pain relief during labor, and some types of orthopedic surgeries. It offers pain relief without the need for general anesthesia. 3. Local anesthesia. Local anesthesia involves the administration of medication to block pain sensation in a specific area of the body, such as a small region or a localized part of the body. It is typically used for minor surgical procedures or medical interventions. How it works: local anesthetics, like lidocaine or novocaine, are injected directly into the area where the procedure will take place. These medications temporarily block nerve signals in the area, preventing pain sensations from reaching the brain. Use cases: local anesthesia is commonly used for dental procedures, minor skin surgeries, example mole removal, suturing wounds, and various outpatient procedures where only a specific area needs to be numbed. Focus on local anesthesia. Local anesthesia is especially valuable for its ability to provide pain relief for minor procedures without affecting the patient's consciousness or the entire body. It is safer and associated with fewer side effects compared to general anesthesia. Additionally, local anesthesia is often preferred for outpatient or minimally invasive procedures, as it allows for faster recovery and fewer complications. The choice of anesthesia type depends on the nature of the medical procedure, the patient's health, and the surgeon's preference. Local anesthesia plays a crucial role in minimizing pain and discomfort for patients undergoing minor surgeries and medical interventions, contributing to improved patient experiences and outcomes. Mechanism of action of local anesthesia. Local anesthesia works by blocking the transmission of pain signals in a specific area of the body, thus preventing the sensation of pain during medical procedures or surgeries. This is achieved through the use of local anesthetics, which are drugs that interfere with the functioning of nerves responsible for transmitting pain signals. The mechanism of action of local anesthesia can be broken down into several key steps. 1. Nerve function. In the body, pain signals are transmitted by specialized nerve cells called nociceptors. These nociceptors are responsible for detecting painful stimuli, such as tissue injury or inflammation. When these receptors are stimulated, they generate electrical signals that travel along nerves to the brain, where they are perceived as pain. 2. Sodium channels. Local anesthetics primarily target sodium channels found on the surface of nerve cells. These sodium channels play a crucial role in generating and propagating nerve impulses, including those that carry pain signals. The opening and closing of sodium channels allow ions to flow in and out of nerve cells, generating the electrical impulses needed for nerve transmission. 3. Blockage of sodium channels. Local anesthetics are typically in the form of a liquid or gel, and they are applied directly to the site where pain relief is needed. When applied, the local anesthetic molecules infiltrate the nerve cell membranes. Once inside the nerve cells, these molecules bind to and block the sodium channels. By blocking these channels, local anesthetics prevent the influx of sodium ions into the nerve cells, which is necessary for the generation and propagation of nerve impulses. 4. Inhibition of nerve signal propagation. With the sodium channels blocked, the nerve cells become unable to transmit electrical impulses effectively. This results in the temporary inhibition of nerve signal propagation in the area where the local anesthetic was applied. As a result, the nociceptors are unable to send pain signals to the brain, and the patient does not perceive pain or discomfort during the procedure. 5. Duration of action. The duration of action of a local anesthetic varies depending on the specific drug used and its formulation. Some local anesthetics are short-acting, providing pain relief for a brief period, while others are longer-lasting. The choice of local anesthetic depends on the duration of the medical procedure and the patient's needs. It's important to note that local anesthesia affects only the specific area where it is applied and does not affect consciousness or sensation in other parts of the body. This localized pain relief makes it a valuable tool in a wide range of medical and dental procedures, from minor skin surgeries to dental fillings and childbirth pain management. Indications of local anesthesia. Local anesthesia is commonly used in both medical and dental procedures to numb a specific area of the body, allowing for the performance of various interventions with minimal pain and discomfort. Here are some common medical and dental procedures that often require the use of local anesthesia. Dental procedures. 1. Tooth extraction. Local anesthesia is frequently administered for tooth extractions, including wisdom teeth removal, to numb the area around the tooth and reduce pain during the procedure. 2. Dental fillings. When treating cavities, dentists often use local anesthesia to numb the affected tooth and surrounding tissues. 3. Root canal treatment. Local anesthesia is essential during root canal procedures to numb the infected tooth's nerve and surrounding tissues. 4. Periodontal procedures. Gum surgeries, such as gum grafts or periodontal scaling and root planing, often require local anesthesia to minimize pain and discomfort for the patient. 5. Oral surgery. More complex oral surgeries, such as dental implant placement or jaw surgery, often involve the use of local anesthesia to ensure the patient's comfort during the procedure. Medical procedures. 1. Laceration repair. Local anesthesia is used to numb the area around a wound or laceration before sutures or staples are applied. 2. Biopsies. When obtaining tissue samples for diagnostic purposes, local anesthesia is administered to the area to minimize pain and discomfort for the patient. 3. Cyst or abscess drainage. Local anesthesia may be used before draining a cyst or abscess to reduce pain at the site of the procedure. 4. Joint injections. Injections into joints, such as corticosteroid injections for joint pain or arthritis, often require local anesthesia to numb the area. 5. Dermatological procedures. Procedures like mole removal, wart removal, or the removal of skin lesions often involve local anesthesia to make the procedure more comfortable. 6. Hemorrhoid procedures. Local anesthesia can be applied to the area before procedures like hemorrhoidectomy to minimize pain during and after the surgery. 7. Vasectomy. Local anesthesia is commonly used during vasectomy procedures to numb the area around the vas deferens. 8. Breast biopsies. Local anesthesia is administered before breast biopsies to numb the breast tissue and make the procedure less painful. 9. Endoscopy. In some cases, local anesthesia may be used to numb the throat or nasal passages before an endoscopic procedure, such as upper endoscopy or bronchoscopy. These are just a few examples of medical and dental procedures where local anesthesia is used to ensure patient comfort and minimize pain during the intervention. The specific type of local anesthesia and its administration may vary depending on the procedure and the patient's needs. Always consult with a healthcare or dental professional for proper assessment and administration of local anesthesia. Advantages of local anesthesia. Local anesthesia offers several advantages in medical and dental procedures compared to general anesthesia or sedation, including reduced systemic effects. Targeted pain relief. Local anesthesia precisely numbs a specific area, allowing the patient to remain conscious while experiencing no pain in the region of interest. This is especially advantageous in procedures where pain control is necessary but full sedation is not required. Minimized impact on vital functions. Unlike general anesthesia, which can affect the entire body and require the use of ventilators and monitoring equipment, local anesthesia has minimal systemic effects. This reduces the risk of complications associated with alterations in blood pressure, heart rate, and respiration. 2. Faster recovery. Shorter postoperative observation. Since patients under local anesthesia remain awake and alert during the procedure, there's typically no need for extended postoperative monitoring. This can lead to a quicker discharge from the medical facility or clinic. Less drowsiness and nausea. General anesthesia often leaves patients feeling groggy, nauseous, or disoriented for hours or even days after the procedure. With local anesthesia, these side effects are usually minimal or absent, allowing patients to return to their regular activities sooner. Reduced recovery time. Recovery after a procedure under local anesthesia is generally faster because the patient doesn't need as much time to regain consciousness and full alertness. Patients can often resume their normal daily activities shortly after the procedure, assuming there are no specific restrictions. 3. Lower risk profile. Reduced risk of allergic reactions. Local anesthetics have a lower risk of allergic reactions compared to some general anesthetic drugs. Lower risk of aspiration. General anesthesia carries a risk of aspiration, where stomach contents enter the lungs, potentially leading to pneumonia. This risk is virtually eliminated with local anesthesia as patients remain awake and can swallow normally. 4. Patient comfort and satisfaction. Patient involvement. Patients under local anesthesia can often communicate with the medical team, providing feedback and alleviating anxiety by knowing what's happening during the procedure. Improved pain management. Local anesthesia ensures effective pain control during and immediately after the procedure, contributing to overall patient comfort and satisfaction. 5. Cost efficiency. Local anesthesia is generally less expensive than general anesthesia because it requires fewer resources, such as an anesthesiologist, specialized equipment, and postoperative care. Despite these advantages, it's important to note that the choice between local anesthesia and general anesthesia depends on the nature of the procedure, the patient's medical condition, and the preferences of both the patient and the healthcare provider. In many cases, a combination of local and general anesthesia, known as regional anesthesia, may be used to provide the best balance of pain control and patient comfort. Disadvantages of local anesthesia. Local anesthesia is a commonly used medical technique to numb a specific area of the body for various procedures and surgeries. While it has numerous advantages, such as minimizing pain and reducing the need for general anesthesia, it also comes with certain disadvantages and potential drawbacks, including 1. Limited area of effect. Local anesthesia only numbs a specific area of the body where it is applied or injected. This limitation means that it may not be suitable for procedures that require anesthesia in larger or multiple areas. 2. Temporary numbness. Local anesthesia provides temporary pain relief, typically lasting for a few hours. Once the effects wear off, the patient may experience pain or discomfort again. 3. Risk of allergic reactions. Although rare, some individuals may be allergic to the components of the local anesthetic. Allergic reactions can range from mild skin irritation to severe anaphylaxis, a life-threatening condition. 4. Systemic toxicity. There is a risk of the local anesthetic being absorbed into the bloodstream, potentially leading to systemic toxicity. This can cause adverse effects on the heart, central nervous system, and other vital organs. Careful dosing and monitoring are essential to minimize this risk. 5. Nerve damage. In some cases, local anesthesia can damage nerves at the injection site, leading to temporary or, in rare instances, permanent nerve dysfunction. This can result in numbness, tingling, or weakness in the affected area. 6. Pain or discomfort during administration. The process of administering local anesthesia, which often involves injections, can itself cause discomfort or mild pain. This may be particularly challenging for individuals with a fear of needles or medical procedures. 7. Skill and experience dependency. Proper administration of local anesthesia requires skill and experience to ensure that the desired area is adequately numbed without causing complications. Inexperienced or untrained individuals may not achieve the desired results. 8. Repeated injections. Some procedures may require multiple injections of local anesthesia, which can be uncomfortable or cause anxiety for the patient. 9. Duration of action. The duration of action of local anesthesia varies depending on the specific type used. For longer surgeries or procedures, the need for repeated injections or a switch to another form of anesthesia may be necessary. 10. Psychological factors. Some patients may experience anxiety or distress when they are fully conscious during a procedure, even if they do not feel pain. This psychological discomfort can be a disadvantage for some individuals. It's important to note that the choice of anesthesia depends on the nature of the procedure, the patient's medical history, and their preferences. Healthcare professionals carefully weigh the advantages and disadvantages of local anesthesia in each case to ensure the safety and comfort of the patient. Administration techniques of local anesthesia. Administering local anesthesia is a crucial aspect of many medical and dental procedures to provide pain relief in a specific area of the body. The choice of technique for administering local anesthesia depends on several factors, including the type of procedure being performed, the patient's medical history, and their comfort level. Here are various methods of administering local anesthesia and considerations for choosing the appropriate technique. 1. Injections. Infiltration. This method involves injecting the local anesthetic directly into the tissue surrounding the operative site. It is commonly used for small procedures on the extremities, such as dental work or suturing lacerations. Nerve block. In a nerve block, the anesthetic is injected near a nerve that supplies sensation to a larger area of the body. This technique is preferred for procedures on larger regions like the limbs or certain dental procedures. Field block. Similar to infiltration, a field block involves injecting the anesthetic around the perimeter of the surgical area. It's used for procedures like skin grafts or excisions. 2. Topical anesthetics. Creams and gels. Topical anesthetics are applied directly to the skin or mucous membranes to numb the surface before a procedure. They are commonly used for minor procedures, such as venipuncture or inserting 4 lines. Sprays. Anesthetic sprays are used in procedures involving the throat or upper airway, such as endoscopy. They are sprayed onto the targeted area to provide local numbness. 3. Intravenous. 4. Regional anesthesia. For regional anesthesia, also known as a beer block, is used for extremity surgeries. It involves injecting a local anesthetic into a vein that is isolated with a tourniquet, effectively numbing the entire limb. Choosing the appropriate technique for administration of local anesthesia. The choice of technique for administering local anesthesia depends on several factors, including the type of procedure being performed, the patient's medical history, and their comfort level. Procedure type. The type and location of the procedure play a significant role in technique selection. For instance, dental procedures may involve infiltration or nerve blocks, while superficial skin procedures may use field blocks or topical agents. Patient comfort and anxiety. Patients may have preferences regarding the administration technique. Some may be anxious about needles and prefer topical agents or alternative techniques, like nitrous oxide for relaxation. Medical history. Consider the patient's medical history and any allergies or adverse reactions to specific anesthetics. Choose the safest option based on their individual health profile. Duration of procedure. Short procedures may benefit from quicker-acting agents like infiltration, while longer surgeries may require nerve blocks or regional anesthesia for extended pain relief. Anesthetic agent choice. The choice of local anesthetic itself can impact the technique. Some agents have a faster onset, while others offer longer duration of action. In summary, the choice of local anesthesia administration technique should be tailored to the individual patient and the specific procedure. Discussing options and preferences with the patient, considering the anatomical area involved, and taking into account any contraindications or allergies will help ensure effective pain management and patient comfort during medical or dental procedures. Local anesthetic agents. Local anesthetic agents are medications used to block sensation in a specific area of the body, allowing for painless medical procedures or surgeries. Here are some commonly used local anesthetic drugs, along with their duration of action and potential side effects. 1. Lidocaine, xylocaine. Duration of action. Lidocaine has a relatively short duration of action, typically lasting for about 1 to 2 hours when used alone. However, it can be extended by combining it with epinephrine, adrenaline, which constricts blood vessels and slows the absorption of lidocaine, prolonging its effects to around 2 to 4 hours. Potential side effects. Side effects may include temporary numbness, tingling, or a burning sensation at the injection site. In rare cases, lidocaine can cause allergic reactions, dizziness, or cardiovascular issues. 2. Bupivacaine, Marcaine. Duration of action. Bupivacaine has a longer duration of action compared to lidocaine, typically lasting 4 to 8 hours. When combined with epinephrine, its effects can be extended further. Potential side effects. Side effects are similar to lidocaine and may include numbness, tingling, or muscle weakness. Systemic toxicity, though rare, can occur and may manifest as cardiovascular and central nervous system symptoms. 3. Ropivacaine, Narapin. Duration of action. Ropivacaine is similar to bupivacaine in terms of duration, lasting around 4 to 8 hours. It is also commonly used for epidural and regional anesthesia. Potential side effects. Side effects are similar to those of lidocaine and bupivacaine. Ropivacaine is considered to have a better safety profile in terms of cardiac toxicity compared to bupivacaine. 4. Procaine, Novocaine. Duration of action. Procaine has a shorter duration of action, typically lasting around 30 minutes to 1 hour. It is less commonly used today due to its relatively short duration. Potential side effects. Side effects are similar to other local anesthetics and may include numbness, tingling, or allergic reactions. 5. Mepivacaine, Carbocaine. Duration of action. Mepivacaine's duration of action is similar to lidocaine, lasting approximately 1 to 2 hours. Like lidocaine, it can be extended with epinephrine. Potential side effects. Side effects are similar to lidocaine, with potential numbness, tingling, or a burning sensation. 6. Articaine, Septicaine. Duration of action. Articaine has a relatively short to moderate duration of action, lasting around 1 to 2 hours. It is often used in dental procedures. Potential side effects. Side effects are similar to other local anesthetics and may include numbness, tingling, or swelling at the injection site. It's important to note that individual responses to local anesthetics can vary, and the choice of anesthetic depends on the specific procedure, patient characteristics, and the expected duration of pain relief. Local anesthetics are generally safe when administered by trained medical professionals, but they can have side effects or rare complications, especially if used improperly or in excessive amounts. Patients should discuss any concerns or medical history with their healthcare provider before undergoing a procedure involving local anesthesia. Preoperative preparation. Preparing a patient for local anesthesia involves several important steps to ensure their safety and comfort during the procedure. Local anesthesia is typically used for minor surgical or medical procedures to numb a specific area of the body. Here's a general guideline for preoperative preparation of local anesthesia. 1. Patient assessment. Review the patient's medical history, allergies, and current medications. Assess the patient's overall health, including vital signs, blood pressure, heart rate, respiratory rate, and temperature. 2. Informed consent. Explain the procedure, risks, benefits, and alternatives to the patient. Obtain informed consent from the patient or their legal guardian. 3. Medication review. Review the patient's current medications and adjust them as necessary, especially blood-thinning medications that might increase the risk of bleeding. 4. Allergy assessment. Check for any known allergies to local anesthetics or related substances. 5. Preoperative labs. Depending on the patient's health and the procedure, order any necessary preoperative laboratory tests such as blood counts, coagulation studies, or metabolic panels. 6. Patient preparation. Ensure the patient is in a comfortable and appropriate position for the procedure. Provide a clean and sterile environment in the procedure room. 7. Skin preparation. Clean and disinfect the area where the local anesthesia will be administered to reduce the risk of infection. 8. Local anesthetic choice. Select the appropriate local anesthetic agent based on the procedure, its duration, and the patient's medical history. 9. Equipment and supplies. Ensure that all necessary equipment and supplies are readily available, including sterile needles, syringes, local anesthetic solutions, and any additional items required for the procedure. 10. Monitoring. Continuously monitor the patient's vital signs during the procedure, including blood pressure, heart rate, and oxygen saturation. 11. Documentation. Document all preoperative assessments, patient consent, medication administration, and any other relevant information in the patient's medical record. 12. Patient comfort. Explain the procedure to the patient, provide emotional support, and address any questions or concerns they may have. 13. Infection control. Follow strict aseptic technique to prevent infection during the administration of local anesthesia. 14. Emergency preparedness. Be prepared for potential complications or adverse reactions to the local anesthetic, such as an allergic reaction or overdose. Have emergency medications and equipment on hand. It's essential to tailor the preoperative preparation to the specific patient and procedure, considering individual health factors and the type of local anesthesia being used. Additionally, healthcare professionals should follow institutional policies and guidelines for preoperative care. Administration procedure of local anesthesia. Administering local anesthesia is a medical procedure that involves the controlled introduction of anesthetic agents to induce a temporary loss of sensation in a specific area of the body. This is commonly done in various medical and dental procedures to reduce pain and discomfort. Below are the general steps involved in administering local anesthesia, along with safety measures and infection control practices. 1. Patient assessment. Review the patient's medical history, allergies, and any medications they are currently taking. Conduct a physical examination to assess the patient's overall health and suitability for anesthesia. 2. Informed consent. Explain the procedure, potential risks, and benefits to the patient. Obtain written informed consent from the patient or their legal guardian. 3. Preparation of equipment and supplies. Gather all necessary equipment and supplies, including anesthetic solution, example, lidocaine or articaine. Syringes and needles of appropriate size. Sterile gauze, cotton balls, or swabs. Antiseptic solution for skin preparation. Gloves, mask, and eye protection for the provider. Proper disposal containers for used needles and materials. 4. Hand hygiene. Perform thorough hand washing with soap and water before donning gloves. 5. Patient positioning. Position the patient comfortably and ensure good visibility of the treatment area. 6. Skin disinfection. Cleanse the skin or mucous membrane in the treatment area with an antiseptic solution to reduce the risk of infection. 7. Anesthetic preparation. Prepare the anesthetic solution according to manufacturer instructions. Assemble the syringe and needle. 8. Needle insertion. Wear gloves and follow aseptic technique. Stabilize the area and insert the needle slowly and at the correct angle to minimize discomfort. Aspirate to ensure the needle is not inside a blood vessel. 9. Slow injection. Administer the anesthetic solution slowly to minimize pain and swelling. Monitor the patient for any signs of discomfort or adverse reactions. 10. Wait for anesthetic effect. Allow time for the anesthetic to take effect before starting the medical or dental procedure. 11. Monitor patient. Continuously monitor the patient's vital signs and response to the anesthesia. Be prepared to manage any adverse reactions or complications. 12. Proper disposal. Safely dispose of used needles and other contaminated materials in accordance with medical waste disposal regulations. 13. Post-procedure care. Provide post-procedure instructions to the patient, including advice on how to manage any residual numbness and potential side effects. 14. Documentation. Document the procedure, including the type and amount of anesthesia used, patient's response, and any complications or adverse events. Safety measures and infection control practices. Always follow standard precautions for infection control, including proper hand hygiene and the use of personal protective equipment. Ensure that all equipment and supplies are sterile or properly disinfected. Maintain a clean and organized workspace. Dispose of sharps and contaminated materials in designated containers. Adhere to local regulations and guidelines regarding the administration of anesthesia. Be prepared to respond to any adverse reactions, such as an allergic reaction or overdose, with appropriate emergency measures. Continuously update your knowledge and skills through ongoing education and training in anesthesia administration. Remember that the specific steps and safety measures may vary depending on the type of procedure, the location of the anesthesia administration, and local regulations and guidelines. Always consult with a qualified medical or dental professional and follow their recommendations for administering local anesthesia. Patient comfort. Minimizing patient discomfort during anesthesia administration is crucial for providing a positive surgical experience and ensuring patient safety. Several techniques, including distractions, positioning, and effective communication, can be employed to achieve this goal. 1. Distractions. Preoperative counseling. Before the procedure, healthcare providers can explain the anesthesia process to the patient and address any concerns or questions. This can help alleviate anxiety and provide a sense of control. B. Relaxation techniques. Encourage patients to use relaxation techniques such as deep breathing exercises or mindfulness meditation before anesthesia administration to reduce anxiety. C. Music or audio. Playing soothing music or offering noise-canceling headphones can distract patients from the procedure and reduce anxiety. D. Virtual reality, VR. Some healthcare facilities use VR headsets to immerse patients in a calming virtual environment, diverting their attention from the procedure. 2. Positioning. A comfortable position. Ensure that the patient is positioned comfortably on the operating table. Proper padding and support can prevent pressure sores and discomfort during the procedure. B. Limb positioning. For regional anesthesia, example epidural or nerve blocks, proper limb positioning is essential. The use of cushions or foam supports can help maintain comfort and stability. 3. Communication. A. Open dialogue. Maintain clear and open communication with the patient throughout the anesthesia process. Address any questions or concerns promptly. B. Empathy and reassurance. Show empathy and reassure the patient about the steps being taken to ensure their comfort and safety. C. Consent. Ensure that the patient fully understands the anesthesia procedure and has given informed consent. 4. Local anesthesia. A. Topical anesthetics. Apply topical anesthetics or numbing creams to the injection site before administering 4 lines or injections. This can reduce pain during needle insertion. B. Local infiltration. Use local anesthesia techniques for certain procedures to minimize pain at the surgical site. 5. Intravenous. 4. Techniques. A. Use a smaller gauge needle for 4 placement to reduce pain and discomfort. B. Administer medications slowly to prevent pain or a burning sensation at the injection site. 6. Monitoring. A. Continuous monitoring. Keep the patient continuously monitored for vital signs, depth of anesthesia, and pain levels. Promptly address any signs of discomfort or distress. 7. Postoperative pain management. A. Ensure that the patient receives adequate pain management post-surgery to minimize discomfort during the recovery period. 8. Pediatric considerations. A. Pediatric patients may require additional techniques such as parental presence, age-appropriate explanations, and comfort items, example, a favorite toy or blanket, to reduce anxiety and discomfort. 9. Geriatric considerations. A. Older patients may have unique needs, such as additional padding, assistance with positioning, and special attention to communication due to potential hearing or cognitive issues. By employing these techniques and tailoring them to the individual needs of each patient, healthcare providers can significantly minimize patient discomfort during anesthesia administration, ultimately contributing to a more positive surgical experience and better outcomes. Potential complications of local anesthesia. Local anesthesia is generally considered safe when administered by trained healthcare professionals. However, like any medical procedure, it can have potential complications, although they are relatively rare. Some potential complications of local anesthesia include: 1. Infection. While the risk of infection is low, there is a possibility of introducing bacteria into the injection site, leading to localized or systemic infections. 2. Hematoma. Hematoma is the collection of blood outside blood vessels and can occur if a blood vessel is accidentally punctured during the administration of local anesthesia. It may cause localized swelling, pain, and discoloration. 3. Nerve damage. In rare cases, local anesthesia may damage nearby nerves, leading to temporary or, in very rare cases, permanent nerve dysfunction. This can result in sensory changes, numbness, tingling, or muscle weakness. 4. Allergic reactions. Although extremely rare, some individuals may have an allergic reaction to the local anesthetic agent. Symptoms may include itching, hives, difficulty breathing, or anaphylaxis, a severe allergic reaction that requires immediate medical attention. 5. Systemic toxicity. Local anesthetics can sometimes enter the bloodstream and reach toxic levels, leading to symptoms such as confusion, dizziness, seizures, cardiac arrhythmias, and, in severe cases, cardiac arrest. This is more likely to occur with large doses or if the anesthetic is inadvertently injected into a blood vessel. 6. Bruising and swelling. Some degree of bruising and swelling may occur at the injection site, which is usually temporary and resolves on its own. 7. Pain or discomfort. Following the administration of local anesthesia, patients may experience temporary pain, discomfort, or aching at the injection site. 8. Persistent numbness or sensory changes. In some cases, the effects of local anesthesia may persist longer than expected, resulting in prolonged numbness, altered sensation, or loss of sensation in the affected area. 9. Cardiovascular effects. Certain local anesthetics can affect the cardiovascular system, potentially leading to changes in heart rate or blood pressure. These effects are typically more pronounced when larger doses are used or if the anesthetic is inadvertently administered intravascularly. It's essential to discuss the potential risks and complications of local anesthesia with your healthcare provider before any procedure. They will assess your individual health and medical history to minimize these risks and provide the safest possible care. Additionally, healthcare professionals are trained to manage and respond to any complications that may arise during or after the administration of local anesthesia. Postoperative care. Postoperative care is a critical phase in the overall surgical process, and it plays a significant role in ensuring a patient's successful recovery. Here are some important aspects of postoperative care, including the importance of monitoring and instructions for patients regarding pain management and potential side effects. 1. Importance of post-op monitoring. Postoperative monitoring is essential for several reasons. A. Detection of complications. It allows healthcare providers to promptly identify and address any complications that may arise after surgery, such as bleeding, infection, or adverse reactions to anesthesia. B. Assessment of vital signs. Monitoring vital signs like heart rate, blood pressure, respiratory rate, and oxygen saturation helps in gauging a patient's overall condition and ensuring stability. C. Pain management. Monitoring pain levels is crucial to ensure that patients are comfortable and receiving adequate pain relief. D. Fluid balance. Tracking fluid intake and output is important to prevent dehydration and monitor kidney function. E. Wound care. Regular inspection of surgical incisions helps in identifying any signs of infection or wound healing issues. F. Medication management. Monitoring medication administration and potential side effects is crucial to ensure patients receive the right drugs at the right time. G. Emotional support. Post-op monitoring also involves providing emotional support to patients as they recover, addressing any concerns or anxiety they may have. 2. Instructions for patients regarding pain management and potential side effects. A. Pain management. Patients should be educated about the importance of managing pain to aid in the healing process. Discuss the prescribed pain medications, their dosages, and the schedule for taking them. Encourage patients to report their pain levels accurately and promptly to healthcare providers. Inform patients about alternative pain management techniques, such as ice packs, elevation, or relaxation exercises. B. Potential side effects. Explain the potential side effects of prescribed medications and their expected duration. Provide information on how to manage common side effects like nausea, constipation, or dizziness. Encourage patients to communicate any unusual or severe side effects immediately to their healthcare team. C. Wound care. Educate patients on how to care for their surgical incisions, including cleaning, dressing changes, and signs of infection. Emphasize the importance of keeping the incision area dry and clean. D. Activity and rest. Provide guidelines on physical activity and restrictions based on the specific surgery performed. Stress the importance of balancing rest with gradual, safe physical activity to aid in recovery. E. Nutrition and hydration. Discuss dietary recommendations, including any dietary restrictions or modifications necessary for recovery. Encourage proper hydration to support the healing process. F. Follow-up appointments. Schedule and communicate the importance of follow-up appointments with the surgical team. Ensure patients understand when and how to contact their healthcare provider if they have concerns or questions during their recovery. Effective postoperative care involves a partnership between healthcare providers and patients. Open communication, education, and monitoring are key components in ensuring a smooth recovery process and minimizing potential complications.